Hey everybody, we're going to do a quick video about dental care and autism. So Ian just recently got braces. You want to show him your braces? Yeah, nice. And he did awesome. We did have to do some things to kind of set him up for this type of event so he wouldn't freak out. He was pretty nervous about it. One of the things we did is we mentally prepared him beforehand. So we told him that it might be a little bit painful, some of the things he might have to go through, that we would have ibuprofen waiting for him at the end. And I was there with him. They gave me the option to take off and do errands. And I'm like, no, I'm going to hang out with Ian. And I just kind of lightly compressed his ankle, just letting him know I was there the whole time. So when it came to where Ian got his orthodontics work, we were kind of stuck because Brittany got a major discount through her work. So we had to go with this provider. And if I would do anything different, I would have a place where they have separate rooms for each dental chair. Where we were, it was just like a row of dental chairs. So everyone could hear each other like grunting and moaning, and especially if someone on the spectrum is having a really hard time, they might get a little loud and make loud noises. Unfortunately, Ian didn't do too much of that, so it wasn't that big of a deal. But that's just something to keep in mind. If you're looking for a provider, it might be good to have different sanctioned rooms. Another thing that we want to talk about, and Brittany will talk a little bit about this, she's behind camera, is if someone is more severe on the spectrum, or if someone is younger, they're probably going to have a lot more difficult of a time getting dental work. Ian, is there anything else you wanted to say before I turn over to your mom about your braces and how they felt and everything like that?
Yeah.
Go ahead.
So when you guys get braces, just be aware that it may, from my experience at least, they may feel comfortable and nice at first, but then eventually, minutes or hours later, they're gonna feel extremely sore, making your teeth feel like they will get loose enough to come out, but they won't. But in fact, they are not loosened and will never come out. They just feel that way.
Yeah, it's just moving your teeth in place, right?
Yeah.
What is the biggest bummer about braces?
Let's say you're a food eating type of person. You want to eat a lot of different foods. You love gooey foods, you love hard foods.
And you can't have that with braces, right?
No, you cannot, because it will generally break your braces.
Yeah, especially the Swedish fish that you love so much.
Mm-hmm.
Yep.
All right. Let's turn the time over to Brittany real quick here. I'm gonna flip the camera around here. Okay. All right, so I want you to tell us a little bit about Alistair's experience at the dentist, because he had a bit more of a struggle.
He did. We had to change our dentist of the last 10 years to go to a different one that offered nitrous oxide or laughing gas and was kind of more experienced in dealing with difficult children. I've taken him to the dentist every year since he was, 2, but he hasn't actually endured a cleaning until he was like 5 or 6. That's how bad he was at the dentist.
And you had to help hold him in place, right?
And even this last year, I had to have him on my lap and soothe him and, love him and tell him everything's going to be just fine, because he just had the hardest time opening his mouth and letting someone get in there and clean with the little tools and instruments and everything. But this time it was funny because he did get laughing gas, and a little hood on his nose. And everyone reacts differently to laughing gas, right? So he just kind of relaxed and kind of mellowed out. And he started saying, "Oh my heavens," over and over and over. And it was really cute. But yeah, that seemed to work for us. I'm not sure. It depends on your kiddo and how they feel in a strange environment and how much influence you have over them as far as soothing them goes. But I would definitely recommend looking into a dentist that has experience with special needs kids and maybe has those options available.
So another thing that helped too, find a dentist that have the TVs hanging over the chairs. He was able to watch TV the entire time, and that really helped him out.
A lot of them do, which is great.
Yeah, a lot of dentist offices have those now, but some don't. It's a really good distraction. Another thing that helped him too is they gave him, and this might depend where you go, what the provider does, but they gave him their form of cash currency, which are like these little coupon vouchers. But that way he not only did a good job while getting braces, but he continues to maintain them well, and he continues to clean them because they give him some of these dental dollars.
As an incentive.
Yeah, as an incentive, and he can get, merch and, shakes. Yeah, they give him like a Roxbury shake, a peanut butter chocolate one he really loves.
Was that super good, Ian? Yeah,
so
he's like, let's do that again.
Yeah, if you can find a provider that gives incentives, that's another bonus too. I mean, really, it's going to run the gamut, right? Because your child might be completely different, might behave totally differently, might have a screaming fit. I mean, we're just trying to give some pointers, some things that have helped us. And like Brittany said, it might require gas, you know, it might get to that point, because if your kids don't get proper dental work, it really could cause a lot of huge problems later on. So it's not like we want to get this done. It is a very needful thing. And so
We could talk about why he needs braces.
well, yeah,
Did you mention
his
that
teeth
at all?
are really crooked.
Well, no, they were crowding on the bottom.
Yeah, he had a
He
lot
had
of
pain.
dental problems. So
He had serious pain,
Yeah,
and he
it
has
was-
a major overbite.
yeah, it was causing him pain. So the braces are very timely. And we had to wait to get the braces until all of his baby teeth were out and some of his other teeth moved around. So
He still doesn't have any second molars all the way in,
yeah.
but we're waiting on those, and they'll come soon, huh? Pretty exciting. Anything else you want to say, Ian? Any advice for people getting braces? Just
Even though braces may seem painful and unpleasant of what you eat, and maybe even having to go to appointments over and over, depending if you eat bad things or not. Once you're done it after like a couple or more years, you'll be glad you wore braces for years.
nice straight teeth that don't hurt.
Yep.
Oh yeah.
Awesome.
Awesome.
All right. That's it, guys. If you have any questions or comments, let us know, or any experiences, please feel free to share. Thanks, everyone.